We have our next speaker to join us this afternoon. Given her extraordinary schedule, she has made time, effort, and energy to share her remarks with PACHA and with the Texas community this afternoon. So without further ado, we will go right into hearing from Dr. Rachel Levine, Assistant Secretary of Health at the U.S. Department of Health and Human Services. Dr. Levine, the floor is yours.
Well, thank you so much, PACHA co-chair Marlene McNeese, for your kind introduction, and a heartfelt thank you to you and Dr. Vincent Guillermo Ramos for your steadfast leadership as PACHA co-chairs. Greetings, council members, federal colleagues, and community partners in Texas and from across the nation. It is truly my pleasure to join you for the Presidential Advisory Council on HIV/AIDS 80th full council meeting. Now, just a few weeks ago, I had the chance to visit Texas twice, actually. I made trips to Dallas and then Austin, and I was very grateful to have the opportunity to see firsthand the work that is being led there, and I am very much looking forward to continued engagement. I would also like to extend my sincere gratitude to Ms. Kay Hayes, Deputy Assistant Secretary for Infectious Disease, for her exceptional leadership and her many different roles, including her work as the Executive Director of PACHA. Kay and her team have been very busy addressing some of our most challenging public health issues, and through it all, Kay centers her work in uplifting the communities that we all serve, and time after time answers the call of duty with her warm smile and her humor and her unwavering dedication to serving the American people. So thank you, Kay, for your tireless efforts to equitably improve the health of our nation. Thank you, Kay. Throughout March's observance of Women's History Month, we celebrate the outstanding progress that women have led and the work that women continue to champion, especially our important work to improve people's health in the United States and around the world. The National HIV/AIDS Strategy highlights ways to accelerate our collective efforts to address the HIV-related research, prevention, care, and treatment needs of women and girls. In addition to including Black and transgender women as priority populations, the strategy highlights the need to continue research. It also highlights the need to scale up effective interventions that integrate mental health, substance use, and intimate partner violence services into HIV-related services, and to develop effective programs to engage and sustain girls and women in HIV treatment. Across the federal government, agencies are prioritizing initiatives and projects focusing on both Black and transgender women. For example, the Ryan White HIV/AIDS program's Black Women First initiative funded 12 demonstration sites to implement and evaluate bundled programs tailored to improve HIV outcomes, and they are now sharing their lessons and their tools. Additionally, our colleagues at CDC support the She's Well campaign, hashtag She's Well campaign, aimed at increasing PrEP awareness and uptake among women. OIDP's Work of Art campaign features the stories of several Black and transgender women living with HIV who discuss the benefits of HIV treatment and viral suppression. And recently, OIDP launched the Black Women's Initiative, led by Captain Jill Martin and Dr. Marissa Robinson, where they had their first meeting in Houston just a few weeks ago, which included many of the women involved with PACHA. I am looking forward to the work that comes out of this critical initiative. Now, I understand that yesterday there was a panel discussing efforts to improve HIV prevention and treatment outcomes among Black and Latina women. And I know you share my excitement about the potential of the President's executive order issued just last week, and I had the privilege of attending, to expand and improve research on women's health. His directive will ensure that women's health is integrated and prioritized across the federal research portfolio and budget, and will galvanize new research on a wide range of topics, which may include HIV and other infections. likely have already discussed, the President issued his fiscal year 2025 budget earlier this month. As Secretary Becerra noted, this budget lays out a vision for a nation that invests in all aspects of health, fosters innovation, and supports its most vulnerable. This budget continues our shift from a nation focused on illness to one that promotes wellness. The fiscal year 25 budget invests in the treatment and prevention of infectious diseases, including HIV, hepatitis C, and vaccine-preventable diseases such as HPV. The President proposed continued funding for the Ending the HIV Epidemic in the U.S. initiative, the EHE initiative, totaling $593 million, with increases for the Ryan White HIV/AIDS program and the Indian Health Services EHE. In addition, the budget proposes sustained funding for the HIV program, services, and research supported by CDC, HRSA, Indian Health Service, NIH, SAMHSA, and HUD. Importantly, the fiscal year 25 budget also proposes $9.8 billion over 10 years for a mandatory PrEP delivery program that will provide PrEP and associated services at no cost to uninsured and underinsured individuals and expand the number of providers serving underserved communities. It also increases PrEP access for Medicaid and CHIP beneficiaries by requiring states to cover PrEP and associated laboratory services with no cost sharing, and places guardrails on utilization management practices such as prior authorization and step therapy. Together, these proposals will produce net savings over 10 years while at the same time saving lives. Finally, the 25 budget also includes investments to address syndemic conditions that will also support our HIV response. These include investments in viral hepatitis, STIs, substance use disorder prevention and treatment, and mental health services. While lots of work still lies ahead, we want to recognize the achievements made toward notable progress. As people with HIV are living longer, the need for organs available for transplantation has increased, with too few donor organs available nationwide for both people with and without HIV. While people with HIV can and do continue to receive organs from HIV-negative donors, transplants from donors with HIV may reduce the time on the transplant waiting list and associated costs for those recipients. Nearly a decade of research was facilitated through the HIV Organ Policy Equity Act, or the HOPE Act, which made possible previously prohibited research related to the transplantation of organs in which both the donor and the recipient have HIV. HHS intends to propose new rulemaking standards for HIV-positive kidney and liver transplants to help increase access and reduce administrative burdens. As more people with HIV become donors, the overall pool of available organs is anticipated to increase, benefiting all people on transplant waiting lists, since every successful transplant shortens the wait list for all patients. At HHS, we believe in building solutions through a syndemic approach, which seeks to understand the connections between interacting health conditions and diseases and the social and structural determinants of health that influence them, and to act to address them together for greater impact. Taking a syndemic approach to understand and address the interactions of HIV, STIs, viral hepatitis, substance use, and other syndemic conditions can identify new opportunities to intervene that may be invisible when each condition is viewed separately, and it can lead to improved general health and well-being. We are seeing and learning in real time right now the intense impacts of syphilis on some of our most vulnerable communities. As part of our syndemic approach, you may have noticed that recently OIDP has added social determinants of health data to the redesigned and improved America's HIV Epidemic Analysis Dashboard, AHEAD. This data, alongside the data on the EHE HIV indicators, enhances the user experience and provides more context for diverse members of our HIV community. The interconnectedness of HIV with the syndemic of syphilis and congenital syphilis underscores the critical need for comprehensive public health strategies addressing HIV and STIs to mitigate their overlapping impacts on individuals and communities. PACHA is a critical partner in addressing this alarming trend. And as you know, HHS has established the National Syphilis and Congenital Syphilis Syndemic Federal Task Force. Now, I know that Dr. Tim Harrison provided you an update on the task force's activities earlier during this meeting. And I am grateful to Dr. Harrison, Kay Hayes, David Johnson, Deputy Assistant Secretary for Regional Health Operations, Lieutenant Commander Nellie Gazarian, Stephen Tellon, and other members of my team for their absolutely outstanding efforts coordinating the task force's activities. And thank you all to the agencies across the U.S. government who are engaged in this important work. We have all the divisions at HHS, we have the VA, the DOD at the table at this task force. Since announcing the task force during the virtual PACHA meeting in December, the task force is making significant progress. The task force aims to control the further spread of syphilis through monitoring tools, improving patient outcomes, and leveraging federal resources to reduce rates and direct resources to communities most impacted by rising rates. We have met with state health officials, STI and maternal child health directors, as well as state epidemiologists from all of our 14 priority jurisdictions, including Texas. We have many different outcomes that we're looking at. We have process-oriented outcomes, but I have emphasized over and over again that we need to emphasize outcomes. We need to reduce the number of primary and secondary syphilis cases and reduce the number of new congenital syphilis cases. And we are dedicated to doing that. So in closing, thank you very much for this opportunity to speak during PACHA's 80th Full Council meeting. Thank you for your thoughtful engagement during the last 2 days of your meeting and the site visits that preceded it. And carry with you, even after you leave the meeting, the perspectives shared and the challenges encountered as you use the experiences to inform your work in building recommendations to share with Secretary Javier Becerra, our HHS Secretary. And truly, thank you to every PACHA member, federal partner, stakeholder, and community member for joining today's meeting, and as always, for the work that you do every single day. We could not continue towards our collaborative progress without your continued dedication to ending the HIV epidemic. And thank you for the work that you're helping with all of us to truly do that. Thank you very much.
Thank you, Dr. Levine. Thank you for your continued effort and your continued support. Again, we often don't have an opportunity to see and engage with our leadership at the federal level. And when we do, and when we hear about their work and their fight alongside us and their rapid response when we sound the alarm, when the community sounds the alarm, Stephen, and their rapid response to what they've heard. This is the relationship that we must continue to cultivate and build. And one of the things I wanted to take a moment to say, since we didn't have opportunity during the PACHA-to-the-People conversation today, is what do we do with all that we hear? How do we take these meetings, these conversations, and get that incorporated into some actionable work? And so I wanted the public, the community, those of you watching online, to really know and hear and understand how seriously we take your input. Your words are recorded. The notes, can we give a round of applause for the note takers? You have no idea. They go back home and stress. Did I get that word right? Is that what the person's saying? So Kathy, Chloe, all of the folks that help facilitate that, they pull that information together. And when PACHA has its conversations, whether it's in full meeting, whether it's in subcommittee meetings, we are taking those pieces of information, those statements, and it goes direct into our strategic plan, our strategic approaches as we move forward. So we have a strategic planning session come tomorrow where the co-chairs, and that was intentional. The intention was to take all that we've heard. I tried to warn them how special Texas was going to be and that we were going to give them lots of food for thought and actions to take. And so we intended to have Friday be the close of our week and talk about how to prioritize what we've heard. And we heard the charge from Jesse Milan yesterday, and do it quickly and do it while we have the time and we have the will and we have the momentum. So the last thing I'll say about what happens from your feedback is you just heard Dr. Levine talk about and remind us of the work of the Syphilis Task Force. That came direct from you, from members around the table, and others around the country who had continued to say, we're watching a rising syphilis problem. Something has to be done about it. Federal colleagues, you're silent on the issue. Where is your leadership? And when Admiral Levine heard that and went right to work and pulled that task force together in a matter of weeks, that's just simply unheard of, folks. So I want to not belittle and minimize the impact of your words and the impact of your energy and the time of you coming out. In Texas, y'all came out and showed out. I thank you again. But that is what we do. And so the next part of our meeting, we are going to turn to each other around the table and spend a moment in reflection about what we've heard. I know not all of our PACHA members will be with us on tomorrow. The co-chairs will be in that strategic planning session. But take note, if there's some priority things that you want to ensure that we lift up, Vincent and I were chatting, we thought we would have to spend a bit of our day tomorrow brainstorming. But I think we're clear. I think we're clear. So it really is about prioritization. So I'd love to hear from PACHA members who will not be here tomorrow. I want to make sure that we've captured your thoughts, or if you've heard them, then we know we've got your thoughts as well. And then before we open it up to the floor, I would like to invite remarks from my co-chair and then from Kay Hayes.
So Marlene, I think I'd like to go last.
Okay.
And so maybe we can hear from folks that are not going to be here, unless Kay, you'd like to go first. But I would love to actually wrap up at the end. Thanks.
Okay, members, the floor is open. Go ahead, Carol. There you go. Yeah, it's the cookie. I got you. I got you.
Well, thank you for this opportunity to share some of my summary thoughts, not in any particular order, just how they're written. I mean, clearly, the session that we had on the syphilis outbreak and how that syndemic mirrored the HIV incidents and that swath across the South certainly is something that was very powerful. And again, want to as a newbie on here, want to congratulate the ongoing PACHA members who pushed for that syphilis task force and to really see the impact of that. I've said to others, I'm still struggling with trying to figure out how do we take all this information and then what do we do with it? And that's a great example of something of what do we do with it, right? So acknowledging that. Clearly, one of the things I commented on early on was a real understanding of the impact of non-expansion of Medicaid and what that means in funding. And we hear that including around insurance access. And, I know that one of the things that we've talked about in our subcommittee, and I don't know if this is the sort of thing that can come out of, a PACHA recommendation or whatever, is thinking about, can we make recommendations for some of the FOAs or some of the guidance to be more directive. And so when we talk about, for example, that Ryan White recertification that is, allowable to only happen once a year at the federal level, but yet the states are interpreting it different and having every 6 months certification. And I'm hearing from our members over and over again about what a burden that is. People don't have the paperwork, it interferes with care, et cetera. And then the same thing would be for the ability to use ADAP funds or other federal funds for insurance, a demand that it be used for insurance. I clearly hear, and I appreciate that even with insurance, you still have co-pays and deductibles, et cetera, but that's a step in the right direction. The other part that we didn't hear about today, but I know that we've heard this from our constituents, is that the benefit of U equals U and the requirement that U equals U be part of a strategic approach, and that providers talk about U equals U to their patients and clients. Again, that could be another place where we, still trying to figure out what can we do, but as a recommendation to federal funders that be included as a potential requirement in FOAs. And then just two other things. Clearly, that panel on cisgender women, and particular Black and brown cisgender women, was really, really powerful. And that repeated comment about cisgender women not seeing themselves as people who are risk possible. And how do we change that a little bit? Again, that one I'm not as clear about as what is PACHA's role there. But that's and then finally, I did not script this. I was blown away. Thank you very much by the people in the audience who spoke, especially the ANAC members. But I'm thrilled to be here as a nurse representative on the council and share that opportunity with Vincent. We need more nurses. We are diverse. We have a whole range of potential and spaces that we work in and perspectives that we represent. And so I would echo the comments of my colleagues who I had no idea that's what they were going to say. But better representation of nurses on different panels, including PACHA.
I'm not sure who was first, so Mackenzie and Paul.
Oh, he was first, definitely.
I'll go first just so I don't have to potentially follow the fireworks show. Which I love. Thank you, Paul. Thank you so much to everyone for being here, and including community and PACHA, as well as our federal partners. I think this has been a fantastic meeting. I'm always energized by these, and this is no different. And it's been phenomenal to have barbecue as well. One new thought that I didn't mention yesterday, and then I just want to kind of loop back on what I said at the end of yesterday's meeting to make sure that it gets logged and brought forward into tomorrow, as well as into our subcommittee work groups over the next 3 months, which is, as we love to say, where the real work gets done. It's phenomenal input, and it's our job to take it and turn it into output. So I love, and a bit of this is going to echo what Carol said, but I love the idea of using HRSA funding to expand access to healthcare coverage. I think it's a phenomenal idea, and it's a way that you can save money, frankly. Like a month of meds is about equal to a whole year's worth of insurance premiums. So it seems like a 12x potential money saver, which seems nice. And then the other quick double three from yesterday are making it easier to stay on Medicaid, making it easier to stay on Ryan White, expanding those, or just making people not have to reapply, or reducing the paperwork burden. And then assigning EHE funding according to, or EHE or other funding according to states that haven't expanded Medicaid, kind of to fill in those holes. We talk about equity on the personal level, but I think that's a great way of doing equity systematically.
That's right.
If you need this much money to solve the HIV problem in your state, most states say give this much money, and then federal funding fills the other half. for states like Texas that hardly give any money,
That's
we
right.
still need to fill that.
That's right.
So I think it's like a really great way for us to utilize our levers. And I'm excited to have dialogue with our federal partners to problem solve and figure out how to do that. Because I think it's those dollars are like where a big, big impact can be made. And then just to close it out, to stick on the funding stream, looking at how those RFPs are written, how they're reviewed, and then some of the requirements regarding financial infrastructure in order to give smaller organizations, newer organizations, which oftentimes are innovative in nature, because usually you start an organization if you see a problem that isn't being solved, according to how you think of it. And so I'm looking forward to digging more into those in the subcommittee meeting, and I appreciate everyone for helping raise all of these issues, and we're looking forward to working on them to create solutions for us all. So, thank you.
Thank you.
So I have a couple of things. First, I really want to thank the folks from Texas who came out. You need to know you are some of the bravest, strongest, most amazing people, and hearing what you put up with on a daily basis has left me very, very, very inspired. And I just want to say thank you, because you take care of the people I love. And you have no idea how much I know that's needed in Texas. Second is I want to thank the PACHA staff. You all are heroes. Oh my God. I mean, you need to all know it's like herding cats. and the staff is so on top of it. And you know, I go to a lot of meetings. And so really, congratulations on just how on top of everything you are. And I guess I want to end the thank yous to our co-chairs. But Marlene, your home was fabulous. Thank you so much. It was culture. You know, to bring people to your home, to share food, that's what culture is. That's how we build culture. That's how we build community. And it was truly a treat to both eat your food and see your beautiful home. And that was personal. And so thank you so much. You know, that we talk a lot when we first, this is my second PACHA meeting. So folks, it's not like I know that much about PACHA, but this is my second PACHA meeting. And they talk a lot about family, but there is this discussion about how we've built this family of people who we know your lives. And I just want to say thank you for inviting me into this family. You know, it is a very, very important and very, very powerful family. And I don't want to abuse or misstate. I know this is a privilege for me. I absolutely know that this is a privilege. And I am so thankful to sit with all of you. I think this is the thing that I just want to end with. And this is really for my colleagues in Texas. I worry that what can we actually do? And what is PACHA's actual ability versus what the need is? And the problem is the need is so huge. I mean, Stephen, once again, you have moved me in ways that I cannot even begin to describe. And honey, you're an old girl, and we've been doing this for a long, long, long time. And the fact that you're still here, and the fact that we're still here is kind of amazing. And I don't want you to walk away thinking, well, we're going to fix this. Because unfortunately, we only could advise. We don't have the ability to create the real solutions you need. And you need real solutions. And probably the most important solution that all of us can do is vote. You know, that is the thing that's going to make the biggest difference in our ability to carry through with expanded Medicaid, because clearly expanded Medicaid is an issue that we have to address. We're not going to be able to get Texas to expand its Medicaid. We're not. And I'm not, and I don't want to lie to you and pretend like we can. We do not have that ability. And we do not have the ability to have HRSA change its policies. We can make a recommendation, but then what HRSA is going to say to us, but it's the legislation. And so what I want you to walk away from this with is an understanding that we're in this together and that we're going to fight. That we're in this together and that this is a war for our communities and our lives. And that the privilege of sitting here is not forgotten as your story is not forgotten. And so this is the promise I can make to everyone in Texas. I am going to tell your story every fucking where that I go. I have a pretty big platform to tell a lot of stories, and your story has to be told. The Green Zone was just, I'm still angry about that, and I probably will be angry for the rest of my life about that because it is just so unfair. And I really appreciate you telling us the story because I didn't know. I'm not going to lie to you and pretend like I knew. I did not know. And I just am so moved by all of it. And so thank you.
And we will see you later, Dr. Tukes.
Thank you.
Safe travels. See you next time. And I saw DeAndre first in queue and then Marvell.
Cool. Thank you. First off, to the audience and to those online, I just want to say thank you. I don't know if there's ever been a time as an adult that I've been able to say this, but you all make me so proud to be a Texan. And I appreciate you all so very much for all the work that you do. And I have to give my flowers while I have the mic and I can do this because just like Marvell said yesterday about mentorship and mentors in this field who have done so much work that I've gotten to grow from and learn from, Ms. Vanita Ray, I just want you to know that I thank you for everything that you've always done and that you do. And I want you to know that oftentimes we hear about living legends, but I can't put you in that category because you are an icon. Oh. That's exactly what you are, and you deserve to know that, and I hope that you take that with you. To the council, to the advisory board, there are 2 recommendations that I have for us to take back, and I hope that the co-chairs will take this into their meetings tomorrow, and that is for us to have the federal government redefine what a rural area is. We've seen and we heard from people in places like Beaumont, Texas, that is absolutely a rural place. It takes an hour and 30 minutes for you to get from here to downtown Beaumont. There are closer cities to Beaumont, like Jasper and Newton and Silsbee and so on and so forth. It takes them an hour to get to Beaumont in the opposite direction of Houston. But they don't have access to funds and resources that the federal government has put out there because they're not defined as a rural area when they should be. And secondly, we have to prioritize people living with HIV more. As a person living with HIV on this council, I have to be honest and say that I feel that people who are HIV negative and PrEP is more of a priority for our federal government than people living with HIV. I've seen so many sessions, so many bills, so much talk around PrEP, and I don't think that I saw anything around U equals U. I know that not everybody will be able to reach an undetectable viral load. Not everybody will have access to PrEP, but we still talk about it. And my hope is that when we go into our next in-person meeting, that we have a session, that we have a discussion, and we have more intentionality on prioritizing people living with HIV and bringing up undetectable equals untransmittable so that the federal government will keep its promise to notate that it is a priority for us in the United States. Thank you.
In the words of Mariah Carey, we are doing the best that we can with what we got. And I think that is a true sentiment for many of us working in this space, but particularly those that are living in Texas. You all are doing the best that you can with what you got. I know that some people can do more, but I want to leave with a good intent to believe that we all are working collectively to end HIV in our communities. Some of the highlights that I have is definitely private and public partnerships was raised, and this ideal around infrastructure is more than just brick and mortar. It's also about representation that came up in some of our conversation. And to expand on what DeAndre said, what are rural interventions? what work in urban communities don't often work or is not adaptable in rural communities. And so definitely a recommendation to this body is to look at and recommend funding to rural interventions. And my last piece is I believe it is important to convene Black folks to talk about HIV, particularly in the South. And so next week I will be announcing a summit called Black in the South Summit that will happen as a pre-conference at USCHA to convene Black folks. And so I hope to see you. I hope to see you. It will be held at Xavier University because I believe our HBCUs are still the cornerstone of our communities. So thank you so much.
Already calling it done. Much success on the summit. Dr. Wheeler, you're up next.
Thank you very much. Let me just add my voice of thanks to all who have participated. Thinking about the strategic planning that will occur on Friday, and for some of those us who won't be here, I want to pick up on Paul's theme. One is to remind ourselves in the planning that we're all in this together. And that means that our federal partners are not our enemies, and that we need to stand in solidarity with the people who have the responsibility of being at the interface between the higher legislative bodies and the vehicles who are actually operationalizing some of those activities. And it was said yesterday about moving and during the site visit about moving from safe space to brave space. It takes really brave people to stand on the front line and to be able to say to other people who are shouting at them, you are still my ally and my friend. I don't agree with you on every point, but I can't hide behind and say I'm gonna fight you all along the way if I'm not willing to stand with you publicly. With regards to planning, the strategic planning, I do think we need to come back and revisit our commitment to ending the epidemic. And if that's really still the compass north for PACHA. I do believe that in our strategic planning, the word accountability has to be built into whatever metrics we use. And to be consistent with what we ask of communities, we have to have a component of transparency and public accountability. We do these sessions where we go out into the community. It is our responsibility to report back to the community, at least on an annual basis, how we've done in terms of moving the needle forward, because I think that is part of what I was trying to get at earlier about recreating the wheel, is that we have start-stop fits in this work, and we lose historical memory and momentum that must be built upon to make sure that there's a continuity base that is embedded in this work. Because again, as someone who, I think this is my fourth stint on PACHA, my fourth time around. So I've been at the PACHA table for a little bit. And so I've seen some of these topics that we say are lapsing have actually been here. And we need to make sure we're not losing that historical component, but that we're building on it and reminding ourselves what was the commitment. Because as membership changes, you run the risk of mission drift and mission shift, because it's episodically driven by what the fruit of the flavor is of the day. And that compass north is critical. If the compass north is ending the epidemic, let's make that a pillar that we never lose sight of. I want to commend those who are at the leadership of PACHA, but I also want to come back to the statement that was made to the community about the essentiality of voting in the people at the local level and the national level. This is not a time to sit on the margins to say, I have the option not to, because doing that will mean that this body doesn't exist before, and we know what that has looked like before, and it can happen again. Thank you.
You know, and not to put anyone on the spot, but I'm going to put some folks on the spot. Another sort of critical intention behind designing our opportunity and our experience in Texas was to learn and hear direct on the ground about the impact of violent policy and targeted programs, particularly for new immigrants, for communities who are simply seeking better opportunity and better access to what they need for themselves and for their families. So I'd be remiss if I did not ask my PACHA colleagues around the table, particularly my Latina and my Latino brother, your thoughts, your experiences about what you've heard over the last couple of days. Duvia, go ahead.
Thank you so much, everybody. We are taking with us your bravery of the state of Texas and the passion with which you serve our communities of color. I'm definitely going to take that back, and I want to echo one of our PACHA members saying my heart is full. I also want to thank Admiral Levine for stating, how quickly she is moving to help us end the epidemic. She is putting $9.8 billion to help us move the syphilis syndemic along, and we know that that is affecting a lot of people, brown and Black people of our communities, right? I also wanted to mention that we are here for you and we hear you. And we are going to make sure that we take your voices back to our subcommittees and turn those ideas into action, into an agenda that helps us move forward with ending the epidemic. During these last couple of days, we've heard the word innovation. And I know that that's difficult for some of the CBOs that we heard from here in Texas, but I wanted to let you know that we have the capacity of expanding the definition of innovation to fit the needs of our community, right? We need to think outside the box, and if expanding that definition to meet the needs of our communities of color is what it's going to take to move us forward, we are willing to do that. Capacity building is something that I heard very loudly being resonated throughout the PACHA meetings. Capacity building for individuals living with HIV to act as mentors and to act as people that are contributing to our workforce, working for individuals living with HIV, and inclusive of undocumented immigrants coming to this country. I think we need to figure out a way to be inclusive because these individuals want to give back. They're passionate. They've been embedded in our communities for generations and generations. And it is time that we find a solution that works to be inclusive of this community. We also heard the word moratorium being resonated throughout our PACHA meetings and how that is going to help us build trust in our communities of color. We also heard that we need federal mandates in Texas that allow individuals to access HIV care and medical care that is going to be critical in saving the lives of people of color in this state. We also heard the need for nurses to be added as part of the workforce solution to close the gaps in care for services needed for communities of color. We heard changes to policy and an urge to help the state of Texas and all states across the nation with changes, necessary changes to Ryan White policies that make eligibility more accessible to our communities of color. And lastly, we also heard Medicare for long-term survivors and making a process that makes Medicare for our long-term survivors more efficient and a process that is easier for people to be eligible for. So we are taking these back. I want you to know that we're taking these back to our subcommittees, and they belong to different subcommittees, and we are going to make sure that your voices are heard because we are here and we hear you and we see you, and you have 100% of our support.
Thank you, Duvia, and thank you, Marlene and Vincent and PACHA as a whole. But you know, I want to really support what my hermana, my sister, just shared with all of us. I just want to add a couple of elements that I think will complement Duvia's remarks and requests from Marlene to hear from our comments. One, that stigma is still a fundamental barrier, not only in Texas, but you know, we need to go recognize that across the 50 states and the territories, Puerto Rico and the U.S. Virgin Islands. Texas is and I will echo what Paul said, we recognize how hard the work is in Texas, but also in the Deep South, in Florida, and because it is even more barriers, more communities are under attack. I was looking the latest HIV infections in Texas, and it's 1,472 among African Americans, Black, 900 among white non-Hispanics, 188 of multiracial, and 2,262 among Hispanic Latinx. And I think we need to acknowledge that, And I always say to my peers that in my experience, we do more when we work together, when we complement each other, when we acknowledge, as Dr. Wheeler was saying, the historical background. If we don't recognize and acknowledge how strong we are when we learn from each other, we complement each other, we coordinate, we communicate, we share strategies, we're not going to be able to advance the big goals ahead of us. I also want to acknowledge and recognize rural, suburbia, and city. They're so different, but in the South, especially Texas, Florida, and the Deep South, it's deeper. And let me remind all of us that most of the infections, 52%, if I'm not mistaken, are in the South. That means we're not going to be able to reach the goals if the South don't lead us. And I think the challenge is for us, thank you, the challenge is for us to be humble and follow the South. And I want to also acknowledge that we need to center people living with HIV because they embody how a fundamental component, active component, and we have to not only recognize but also pay their services, their support, because they're key for advancing, again, the goal of ending the HIV epidemic from a syndemic perspective. And finally, the issue from Hispanic Latinx, as Marlene requests, was a word that was used yesterday, transnational, meaning that especially in Texas and California and other states with border with Mexico, we need to go back and also discuss how we support by national approaches, cooperation to make the difference, and not to focus and put labels and focus on a crisis, but on a solution. The glass has to be half full in order to be supporting each other and keep the hope and perspective to make the difference. And again, I want to recognize again that, and this is, by the way, this is the week of National Farm Workers Awareness Week. And I want to also remind you that we enjoy the food, but somebody has to, break their backs to produce that food. And then as is recognized, March 25th, 31st, and this PACHA meeting is taking place, and Spanish farm workers are campesinos, campesinas. And they are also, I don't want it to be also invisible, because someone was mentioning, I think, working in rural areas, that it's so hard to engage seasonal and farm workers. They say right now the person is in LA because it's where they have to go and pick it up and get engaged in the fields. But we know the mobility, that is another complexity of many that we need to address. And I want to recognize the organizers and our amazing co-chairs, and also for bringing PACHA to Texas. I'm so grateful. And again, I also take the commitment to bring your voices and your concerns to all these places that the Latino Commission and our partners, especially the National Hispanic Latinx Health Leadership Network, that will be meeting in El Paso as one conference, and then in DC on health policy, we're going to be discussing this. Thank you very much.
This may be a transition to the meeting tomorrow, if that's all right. For those of us who are co-chairs, and I co-chair the HIV and Aging and Long-Term and Lifetime Survivors Committee, along with my esteemed co-chair, Alicia Diggs. I'd like to start by thanking Texas and Texans for making this meeting so possible. I have been informed in ways I didn't expect to be informed, and I've been inspired in ways that I didn't expect to be inspired. And I've been more worried and more scared than I expected to be worried and scared about. And that's because of the honesty that we've heard from all of you and the clarity we've heard from all of you about what is truly happening here in Texas, which I'm afraid is also being replicated in many of the other states in the South. And so this has been very helpful. Thank you to Marlene and Vincent, and especially to Marlene for being the great hostess, but also for helping to guide us. And always to the HHS staff who just do a remarkable job of keeping us together and organized. I've been a co-chair of more than one federal advisory committee and grant review committee, and I've been around this table and many tables for a long time. And I've been a government contractor. I've been an AIDS director. I was AIDS director for Philadelphia. I've been in all these many different scenarios and roles. And I am still unclear about all the authorities that Secretary Becerra actually has sitting on top of HHS. And so what I want to suggest what I'm going to tell you, I'm going to recommend tomorrow for the co-chairs to do is to do a bigger assessment of where we might be able in the immediate future to help resolve some of the issues that we've heard today over these last few days. And I think those avenues include a pretty strong authority that the secretary may have, but also the use of mechanisms that are already in place that the secretary and the agencies that report to him, including HRSA and CDC, might be able to use. So I think we need to do a strong investigation as to whether or not a public health emergency should be declared for all the states that have not yet expanded Medicaid. Let's do that assessment, because if states are not even achieving the level of virus suppression that is being achieved nationally by the Ryan White program, then there is an emergency. And that includes whether or not people are actually viral suppressed and U is happening. I think we need to make sure that the secretary looks at all existing regulations, contracts, and cooperative agreement mechanisms under his authority to determine whether or not there are immediate ways in which he can mandate or require that states that have not expanded Medicaid do so immediately by providing insurance strategies so that those who are not insured, who are living with HIV and vulnerable to HIV, can have access to private insurance. He needs to look at what those mechanisms might exist that can mandate that the states do that. Similarly, I think we need to ask the secretary to look at whether or not there's a mandate that can be implemented through existing cooperative agreements and mechanisms that every state have on its formulary all the FDA-approved mechanisms and modalities and medications for HIV, including single-dose regimens and injectables. Let's see whether we can use the current mechanisms to update every state formulary. And I think we need to do the same thing with regard to criminalization laws. And we need to do the same thing with regard to molecular HIV surveillance to see whether or not there are ways that we can use existing mechanisms to say, stop doing this or else. And those mechanisms may already be. Then we've heard many, many things about health systems, about the amount of time that we get to spend in provider appointments, about the role of nurses, about rural health, about U equal U and PrEP. All of those systems issues cross-cut every single key population that we are representative of. People living with HIV, Black and brown, immigrant, gay, straight, cis, transgender. Every single one of those issues, from criminalization to Medicaid expansion to how we get health insurance, formularies, role of nurses, all of those issues we can look at in this key strategic planning session with the co-chairs. But I'm going to recommend that we do these two things. Should there be a public health emergency, and what systems and contracts and mechanisms are in place right now? And I think we need to ask the Secretary to report back to us by June, our June meeting, because we don't have much time.
Thank you, Jesse. So I'm gonna maybe just say a couple of my own thoughts and then turn it over to Kay for some additional commentary. But I want to start by just saying that I'm deeply thankful for the ability to be here and to be part of the local context. My sort of immediate emotions and feelings about being present in Texas were that the work is so purposeful and it's so clear in terms of why people are doing what they're doing. And each of the site visits, I felt that there was such deep commitment. And for that, as the PACHA co-chair, I'm deeply grateful. So thank you very much, Texas, for showing us what it looks like. Also want to acknowledge, quickly, but we'll come back to this a little bit later, all the folks behind the scenes that make PACHA operate, particularly Catherine, Chloe, and the others that have really stepped up and have gone above and beyond. Boy, do we have an amazing experience. And so thank you. There's no way to not recognize Kay Hayes because of the longstanding commitment, the leadership, and the vision to create the team that is supporting us. So thank you very much, Kay. I'm going to come back to Marlene in a second, but I'm going to wrap up my comments with Marlene. But Marlene, I've got you on the list of things I want to address. So I won't repeat, Jesse, all the things that you said. I think there was such wisdom in the room. I think what I'd like to just emphasize is that we do have, and I think Marlene, you and I have discussed this, we have clarity going into strategic planning tomorrow. I think the question that we have to ask ourselves is what are the tactics, mechanisms, what are the levers that we can actually utilize to advance the work? I think we need to be bold and big and think in innovative ways, but think in ways that we can move beyond our deep commitment and passion to actual actions that are substantive, that are really hitting progress and change. And so I look forward to tomorrow and know that people during public comment and also PACHA-to-the-People gave us really important ideas about how we can do that. I want to highlight a little bit on something that has been perplexing to me that has to do with the workforce. I know that in the EHE subcommittee that we're working towards reimagining the workforce. And today we heard a lot about nurses. I'm going to take a step back for a second. I happen to be a nurse practitioner, but I'm going to take a step back. There are no winners and losers here. We are all battling sort of the same enemy, and we need an interprofessional workforce that is free to operate at the top of our training, our competency, and our license, and that actually together, whether it be pharmacists, whether it be community health workers, social workers, whoever it is, including nurses, that we can actually do the work that we've been trained to do. We know as a nation that we can do this. During the COVID emergency pandemic, we removed regulatory barriers. Nothing bad happened. In fact, many of us were able to sacrifice our own health and well-being to be on the front lines to respond to our nation's needs. It is unconscionable that many states have reverted back to regulatory restrictions. If we want to end HIV, and this is something that, great wisdom in what Dr. Wheeler said about the importance of historical perspective and really asking the fundamental question, what are we doing and what is our political will and our commitment to ending HIV, And we've got to get real about pushing against these things that seem really arbitrary and that don't make sense. They're not rooted in evidence. It's time to do that. And I hope that APACHA will be able to do that. I'm going to wrap up by just acknowledging Duvia and Guillermo, because I think that the invisibility of many communities, and during PACHA, we could probably go through a list of all the communities that are often overlooked. But at this meeting, we heard about one particular community that I want to highlight, which is the Latino community. And we heard about the importance of the region and why it's critical that we think not only about new arrivals to our country, but all the diversity in the Latino community that is so essential to the future of our nation within HIV and within our economic, social, and all sorts of aspects of our future well-being as a region, Canada, Mexico, and the United States. So thank you. It's been a pleasure. And before I end, I want to just say a couple of things about Marlene. So Marlene, Paul says this a lot, oh my God. I can't say it the way you say it, Paul, but I would say, oh my God. And so what an amazing site visit. I don't know how we're going to continue down this path because you've set a bar for us, but I wanted to acknowledge that going to your home and having an opportunity to connect and to be together. And we've had moments, I know many of us have had sidebar experiences that have brought us together as people where we've had a chance to talk and connect. It matters to doing the work. We recharge when our batteries are low. We recommit. We get to know who we really are. Marlene, you created that space for us. And so one of the things that I wanted to make sure that everyone on PACHA recognizes that we want to do the same for you. So we are extending to you a small token of our appreciation. We're sending you to a spa, Marlene. Thank you very, very much. From PACHA.
Oh my God. I'm not going to say anything. I have been in tears. I have been in tears all week. I am beyond full and humbled and honored. And we don't often get thanked. And I have tried forever, many of you who've known me for years, to go outside of our city, go outside of our state and try to tell our story to people that matter who could help us move the needle. We have been, I say, in the street fighting, windmilling, just doing the straight street work for years. And this is the first time where I feel seen and heard fully. And that is because of the commitment of the people around this table to say, Marlene keeps talking about Texas. I think we need to go to Texas. And more importantly, for the people who came in this room on purpose. I won't go into detail about how horrible it is to get through to the medical center. But the idea that you all came, Texas, you showed out and you told our story. I don't have the words. I love you. I love you. I love you.
We love you. Well, I guess PACHA can keep a secret, huh? Well, I would be remiss, just a few comments, and I've heard this throughout the day, but it has to also come from me. I want to thank Caroline. This woman is amazing. I want to thank Chloe, who is a new member to Team PACHA, who just stood up and went, Chloe. I want to thank Emily. Emily's back there and organizing site visits. Katarina, who you guys know, Katarina, Stephen. Of course, Dr. Harrison over here. We call him the professor. I want to thank Marissa. Marissa and Jill heard my cry, my fire in my belly about women in HIV. I said, take it. I want you to run, run, run. And they are running. They've just started running. So they've got lots more to run. But yes, but they're taking that and running. I want to thank Sharonda. She is our operations key that makes these things happen. I want to thank Miguel and Rashawn that are here in this space to help us because we're all about communications. We need to get this out. I want to thank Ann, who's also operations, making these things happen, and our contractors. And I want to thank Sean. Sean on my team is on my vaccine team. He's here in Houston. I said, you need to come to PACHA. I need you to see this because I want to replicate some things in our vaccine space. So thank you, Sean, for being here 3 days all the time. So thank you. So now when I talk about exciting news, and I'm happy to share exciting news, you know, PACHA is my passion. You know, I've always thought, you know, I don't know if people say out of the box. I don't know if I've ever been quite in the box, but it's okay. But so I hold this really close to my heart. And so I do wear many hats, heels and hats, and all kinds of things. And so, and I try to lead with innovation. I try to lead with intentionality and compassion. And so this PACHA-to-the-People was an innovation because I was like, why do we always meet in DC? Do I have to? Is there some regulation? Is it against the law? You know, I don't want to go to jail. I don't want silver bracelets. So what can I do? So I found out it wasn't. So I was like, oh, well, let's just change this. You know, we come to DC and we hear the same, not the same thing, which is okay. But let's hear from people that are in communities, in community spaces. Let's go to their homes. And so to see this and to come to Houston and the impact and to see all of you here for this has been amazing. So with that, one of my heels, I'm going to pass, I'm the DFO of PACHA, which is the terminology designated federal official. I'm also the director of the office. So this hat of DFO will be Caroline Taliff as the new... Yes. Yeah. So Caroline will be the new DFO. And so Caroline has served as my alternate DFO. So the new alternate DFO of PACHA is Dr. Tim Harrison. Yeah. So just a few things and I will wrap this up. This is family. You know, when you feel like you've been a part of something and you're so passionate, it's like, I'm giving it to family. They understand. And the thing is, I'm still here at the table, so it's great. One thing you already know about Caroline, she's a taskmaster, okay? She is a taskmaster. She will drive an agenda. She drives the mission. She has that can-do spirit. And she's an advocate activist. She's on the front line of many things. I'm the one saying, that looks a little dangerous. She's right there. And Dr. Harrison, he's the professor in our office. He's methodical. He's a thoughtful person. He's that thought leader. And so that's why we call him professor. Our nickname for Tim is the professor. And for those of you, Dr. Harrison has led and has been in this office in this space since 2003, leading the Minority HIV/AIDS Fund and watching it, caretaking of it. And so I'm looking forward to their leadership together with the three of us in here, because now I just sit 2 seats down as a federal partner. So I'm still at the table, and I just wanted to share that wonderful news and talking about what I also hold very dear is mentorship and leadership. This didn't happen overnight.
Right.
It did not happen overnight. There were many conversations where you have to push people sometimes, and then you have to walk with them and push a little more and walk a little more and push a little more before you say, okay, I'm going to push one more time and then I'm going left. So with that, I turn it back over to our co-chairs.
Sorry, I just want to take a minute here to make a few remarks. First of all, thank you so much, Kay. If anyone has ever talked to me for more than 5 minutes, in any context, in the grocery store, at work, you know how I feel about this woman. I love her. She's my mentor. She's my shiro. She's my family. I worked with Kay since 2012, and to say it's been a privilege to work underneath her, to observe her, to learn from her is an understatement of the year. I don't think there's a word that's strong enough, so we'll just say privilege for now. It's also been a privilege to work with PACHA for the last over a decade. I've been around incredible members, starting with my chair, Nancy Mann, to Dr. Wheeler, to Vincent and Marlene. Over the years, we've lost members, including most recently Dr. Ada Adamora, who I fiercely admired. Okay, 1 second. They said, breathe through your nose. As I step into this new role, I can't help but reflect on the work that we've accomplished over the years. One of my first projects with PACHA was in June 2012, helping with the CHAC and PACHA Safe and Voluntary HIV Disclosure Summit, chaired by Douglas Brooks and Antigone Dempsey. And I'll never forget being in that room when the ACA, or when the Supreme Court voted to uphold the ACA, and how the room was overcome with emotion, and we had to take a pause because we knew the profound impact that the ACA would have on giving people access to quality health care and preventative services. That same year, a few weeks later, I was with PACHA at the International AIDS Conference. The first time it was back in the United States since 1990 because Obama removed the HIV entry ban on the United States. In 2013, I helped with PACHA release their Achieving an AIDS-Free Generation report, the first report in over a decade. It's time for another one, I think. Yeah. 2014, I worked with Douglas Brooks and ONAP with an HIV and Employment Task Force. In 2015, I helped support PACHA and CHAC in a meeting in Atlanta with ONAP, and one of our first PACHA-to-the-People that Kate created, and it's been an honor to help implement over the years. In 2017, I helped support the HIV-related Stigma Reduction Summit convened by former members Gabriel Maldonado and Scott Chavez. 2019 to the present, we have been scaling up PACHA-to-the-People with Jackson, Fort Lauderdale, Phoenix, Appalachia, and of course, Houston. Looking ahead, I'm thrilled to continue the work that we've been doing, growing our team with Kay, Tim, Chloe, and our whole OIDP team here to continue build and expand on this vision of PACHA-to-the-People. And so this is such an honor. Thank you so much.
Dr. Harrison.
Thank you. It would be an honor to work as the alternative DFO. I believe that we have the right person in the right position. So I'm really excited. And Kay, thank you again for your leadership over these many years. I really want to thank Houston. I've been down here once before. Been in Texas, other parts, Dallas and Austin, San Antonio. But this is really an incredible opportunity just to listen. And I really, people who know me know how much I value listening, and then really kind of discerning how to move forward. So I really appreciate this opportunity to listen. And sometimes we do a lot of talking, and I really want to emphasize the listening part of that relationship. So Thank you for that. And, coming to these moments like this, I kind of echoing some of the others of being filled with inspiration and filled with challenge. You challenge us. But there's also, I think, rejuvenation and recommitment and resolve to really go back to our various homes and offices and really do the important work that needs to be done. And my mind is racing with ideas of what things we could do, maybe too many ideas. But I really appreciate the opportunity to be here. I also don't take it for granted, and really appreciate you guys welcoming us in your homes and sharing your stories. And that's not always easy. We respect that. We want you to know that. And thank you again to the PACHA for all your work that you do and your commitment. You have other lives, and you come here and you lend your support, your ideas, your brilliance to this body as well. So thank you.
Just simple thank you as I turn it back over to our co-chairs. And I have to specifically call out RLA. Stephanie and Damon are part of the family. They anticipate all of our needs and what we need, and before we even know that we need it. So thank you. And then I want to talk about, when we talk about bringing young people into the space, we have a fellow here who's with us, Ariel, who is from Brown, who's working with us. She's working with our Ending the HIV Epidemic team. And so this was her first meeting to really understand. She'd heard about PACHA-to-the-People, but for her to experience what that is in site visits, it means so much for going back to the work that she'll be doing. So wanted to say a special thank you to Houston for that.
And Kay, sorry, I just wanted to add one more thing that I forgot to say. I also meant to say a big, big thank you and to continue to work Stephanie Tiller, Damon Kane, Dana Trevis with RLA. They help so much, and I just want to say thank you, and I can't wait to continue the work.
And if we go any further, we will all be on the floor in tears. So with that, we are adjourned. Thank you.
Produced by the U.S. Department of Health and Human Services.